Welcome again, everyone, and thank you for joining us. Good afternoon. Thank you for coming in and joining us in CBA and Dr. Cheryl Reynolds for our webinar on diabetes and long-term effects on eye health. Our presenter today, as we mentioned, Dr. Cheryl A. Reynolds, is a professor at the Nova Southeastern University College of Optometry. She was past president of the National Optometric Foundation. She is a planning group member of the NIH NEI National Eye Health Education Program, which is NEHEP, and she is co-chair of NEHEP's Eye Health, My Health campaign that fosters eye health for African Americans and all Americans. Dr. Reynolds, I thank you for joining us once again, and I turn this part of the webinar over to you. Thank you.
Thank you. Well, first of all, I want to say thank you to NCBA, the National Caucus and Center on Black Aging, for having me present again. And congratulations on your new building and all that you do to educate and inform and increase awareness about eye health condition that disproportionately may impact certain communities. So, as was said earlier, when you look at my disclosures, I was past president of the National Optometric Association. The National Optometric Association is an organization that has been dedicated for over 50 years in advancing the visual health of under-supported population of patients, educating patients on eye health diseases, making sure that our schools and colleges of optometry reflect the population that we serve. And I'm currently the Optometric Foundation president. So it's really a pleasure to partner with NCBA. We've been doing this for a year now. So as you know, the reason we do this on different months, but this month of Thanksgiving, of course, is that November is Diabetes Awareness Month. It's a month that's dedicated to just really increasing awareness about this condition. So many individuals, when you look at the statistics and the incidence of this condition, I would say so many individuals, half of the United States population have diabetes and or they are at risk of developing diabetes. So I always start off by you guys, thank you so much for being here, spending some time with me. And maybe you can put your answers in the chat. But do you know or you have a family member or someone that has diabetes? You can put it in the chat. We'll have Angela and Angie kind of look at the chat. I think we all do. I do. And I know that I'm not the only one in this room that knows someone who's been personally battling this condition when it comes to diabetes. But what's important, not only in managing their systemic disease, but also their eye health. And that's what we're going to spend some time on. But before I go into the eye health, I roughly kind of mentioned this earlier. Half of the United States population have diabetes, or they are at risk of developing diabetes. What does that mean? Over 38 million people in the United States currently in 2025 are diagnosed with type 2 or type 2 diabetes, roughly. You know, if you add type 1, a little bit more, but type 2 diabetes, 38 million people. Of that number, when you think about it, that's 1 in 10 individuals with diabetes. But 1 in 5, 1 in 4 individuals, roughly 8 million people, don't even know they have it. They're walking around with this condition, unaware that they have diabetes. And that's a lot of patients. And for us as eye care practitioners, we're going to see those patients because some of the symptomologies from diabetes include changes in their vision. So they're going to come in and want eyeglasses and their contacts because they're not seeing so well. So we're at the forefront of helping to diagnose and detect this condition based on a comprehensive eye exam. 98 million people have prediabetes. Their numbers are a little high, and they have been told by their physician to incorporate lifestyle changes, to lose some weight. We know that a lot of patients now in 2025 are being put on these GLP-1 inhibitors, Ozempic, Wegovy, and Zepbound, Manjaro for weight because they have prediabetes. And we'll talk about that as we go through the presentation. But when you add those two numbers up, that's 130 plus million people, half of the United States population. Did you know, however, that diabetes is the leading cause of new cases of blindness? I don't think a lot of us are aware of that. The number one cause of blindness in working age adults, those individuals that are 20 years old to 74 young, is diabetes and diabetic retinopathy, its complications. So it's so important to detect these conditions earlier, intervene earlier to prevent blindness. We know worldwide cataracts is the leading cause of vision loss, but in working age adults, diabetes is the number one cause. That's why it's so important to get a comprehensive eye exam. And of course, if you do get a comprehensive eye exam, vision loss is often preventable with early detection. So what is diabetes? Really quickly, it's a chronic endocrine disorder. You've got a deficiency in insulin secretion or insulin effect. It can lead to hyperglycemia or elevated blood sugar level, and you can have disturbance in your carbohydrate, your fat, and your proteins, leading to a constellation of chronic complications from high blood sugar levels. When we look at the type of diabetes, you may know someone that has type 1. These patients have to be on insulin. They cannot survive without insulin because their own pancreas can't produce insulin. So they need to be on insulin. Roughly about 10% of patients that have diabetes have type 1 diabetes. Type 2 diabetes is the most common. That's due to aging. Of course, genetic plays a significant role. If you have a family member that has diabetes, you are more at risk for developing diabetes. 95% of cases or 90% of cases of diabetes is due to type 2. If you know someone who had diabetes during pregnancy, it's called gestational diabetes, or you yourself had gestational diabetes, that's where your sugar level is a little elevated. They test you in your second trimester of your pregnancy. They may treat you depending on how elevated it is. The most important takeaway is that 60% of patients that have gestational diabetes, will develop type 2 diabetes in 5 years. So it's even more important to get checked if you have gestational diabetes. There are some patients that might have diabetes due to underlying conditions. They may have autoimmune diabetes in adults, which is latent autoimmune diabetes. They may have drug-induced diabetes, taking steroids. COVID-19 led to an uptick in patients having diabetes because a lot of these patients had respiratory issues and needed, oral or inhaled steroids. And so we know one of the complications of taking steroids could be elevated blood sugar levels. And so you saw a lot of new cases of new onset diabetes in those patients. It's often misdiagnosed as type 1 or type 2. I would say they're about type 1.5. So you probably read literature that there's a type 1.5, and that's those individuals that have these conditions. And then, of course, prediabetes is where your blood sugar level is slightly elevated, and your doctor will talk to you about lifestyle changes and modification. Diabetes, human impact. Diabetes can impact patients from the top of their head to the bottom of their feet. So when you look at the eyes, the complication is diabetic retinopathy. And as I mentioned, it's the leading cause of blindness and vision loss in working age adults. So it's 20 to 74 young. And then, of course, you have nephropathy. Diabetes can impact the kidneys. The leading cause of end-stage renal disease or kidney disease is diabetes. A lot of patients that have diabetes could end up in some cases that they need dialysis treatment. And then, of course, neuropathy, diabetes, nerve pain, amputation. In fact, diabetes is the leading cause of non-traumatic lower extremity amputation in patients because they get infections in their toes because they can't really feel the bottom of their feet that well. And then, of course, macrovascular complications. So diabetic retinopathy, diabetic nephropathy, and diabetic neuropathy is all small blood vessels in your body. So we call that microvascular complication. But then there are patients that have large blood vessels in their body, and that, of course, are macrovascular complication. And that's where you can run the risk of having a stroke or a heart attack from diabetes. Diabetes is one of the leading causes of death in the United States. I think it's the seventh leading cause of death. So it's so important for patients not only to prevent the eye and kidney and the neuropathy, but also to prevent them from getting heart attack and strokes, which are long-term complications from diabetes. It's important for them to get an eye exam as well as to follow up with their treating physician and make sure that their diabetes is well managed. When it comes to the eye disease, there are three diseases or three conditions that disproportionately impact patients with diabetes. Of course, patients with diabetes can be impacted from the front to the back of the eyes and in between. The patients can have drier eyes than normal. Patients with diabetes may present with double vision. We know you have to be very cautious. In patients that have diabetes with contact lens use, they have to be very good control of their glycemia so they don't have infections. Patients can get earlier onset cataracts. They can get changes in the gel in the back of the eye called the vitreous. And of course, in the back of the eyes, the retina, and then of course, the optic nerve. So some of the conditions that disproportionately are common with diabetes or diabetes is a risk of causing these conditions. Of course, cataracts, glaucoma, and diabetic retinopathy. And then this is just a schematic to kind of highlight the eye. So here you have the eye. This space here in the eye, if you think about the eye like a ball, is the vitreous. And you have the front of the eye. That's the part that you see. And then here's that lens in the eye. So here's the cornea. Here's your pupil. When they dilate your eyes, you can see the lens. You can see that there's cataract changes in the lens. Again, as I mentioned earlier, patients with diabetes, if their blood sugar levels not well controlled, it can lead to earlier onset of cataracts. It can lead to worsening of cataracts. And up to 60% of patients have an increased risk if they have diabetes of developing cataracts. Then as you go through the gel, here's your optic nerve. It transmits your visual world to your brain. And one of the conditions that impact that nerve is glaucoma. Patients with diabetes have 40% higher risk, excuse me, let me go back, 40% higher risk of developing glaucoma. And then, of course, the retina and the macular area is also significantly impacted when you have diabetes. Diabetic macular edema is another cause. If your macular area is responsible for you seeing acute fine detail vision. If there's swelling from diabetes, patients have blurrier vision and need treatment. And of course, diabetes causes the blood vessels to get weak over time. And when those blood vessels get weak, they bleed and they leak blood and they form new blood vessels, which are even more leaky. And so patients have diabetic retinopathy and need to be treated for that. Cataracts, as I mentioned, this is just an illustration of cataracts. It is the leading cause of blindness worldwide. As I mentioned, the cataracts is, but diabetes is the leading cause of blindness in working age adults. Patients who have symptomology of blurry, hazy vision, color, it doesn't look as sharp or detailed. Things might be a little bit more washed out with cataracts. And again, diabetes is a significant risk of developing cataracts. Glaucoma. So this is just a patient's optic nerve. So here you see your blood vessels in the back of the eye. Here's the nerve. And if you think about a donut, not that we're hungry, but if you were, you could think about the donut. And it's a round structure, a donut. In the center of that donut is a hole, just like the optic nerve. And then the dough is the dough that you eat, which would be the nerve tissue. When you have glaucoma, it's like we're not sure exactly why patients develop it. You know, genetics play a big risk factor, but so does diabetes because of vascular perfusion to the nerve. The center gets bigger and bigger and bigger until there's no dough of the donut And that's when people are blind from glaucoma. It's irreversible loss of vision. What's really important about glaucoma is that there are no symptoms. And that is why we call it the silent thief of vision. There are no redness, no vision loss, no pain. It's only when the disease has progressed significantly do patients have complaints or have some problems. And the most important thing to take away from this lecture is that it's irreversible. Once your nerve is damaged, there's no rebuilding your nerve. Our goal is to detect it early, treat the patients with topical eye drops to lower the pressure in the eye, monitor them very closely, and that's the only way and the best way we can save sight. If they need additional treatment, laser surgery, or surgery around the eyes, then we refer them for that as well. But the most important thing is early detection, and it's most important for our patients with diabetes to make sure they have a comprehensive eye exam that not only detects for the diabetic retinopathy, cataracts, but also for glaucoma. As I mentioned, and I know in the chat, if you want to participate, what is the leading cause of vision loss in working age adults? Everybody by now should know that it's diabetes and diabetic retinopathy. So these are some of my patients that have diabetic retinopathy. And what is diabetic retinopathy? Again, it's where the blood vessels become weak in the back of the eye due to elevated blood sugar level, the duration of the diabetes, the control of the patient's diabetes, and it causes the blood vessels to not work as well. They start to bleed. You can also see all these yellow spots or signs of ischemia or lack of oxygen because you need your blood vessel to be healthy to get oxygen to the eye. So all these changes in the back of the eyes are indicative of diabetic retinopathy. And then here in this image here, this patient has a lot of changes around the macular area. So again, here's this optic nerve in a patient that has diabetes. You can see that center is big. This patient also has glaucoma. Here are the blood vessels. You see these small pinpoint hemorrhages from diabetes, but also these yellow uh, deposit. And these yellow deposits are leakage. This is how we see leaky blood vessels in the back of the eyes. So some of the symptoms the patients may have early on is none. You can have 20/20 vision and have diabetic retinopathy. So it's important to know that vision is not part of the classification. Vision has no impact. You can have really good vision and have severe disease. In some patients, though, they may have blurry vision, especially if their blood sugar levels high, their vision will fluctuate. They may have spots in the vision if they have bleeding in front of their line of sight, and they may have loss of vision, decreased vision. Of course, the only way to detect changes in the back of the eyes is with a comprehensive yearly diabetes eye exam with dilation to make sure that there's no bleeding. And the treatment when a patient has diabetic retinopathy is injection in the eyes. So your doctor may say that you need the latest, most efficacious treatment, and that would be injections in the eye of a substance. There's no pain. It's just a small, a little not even say pinch, but they numb your eyes. They inject the medication in the eye to help reduce the swelling and help to reduce the bleeding in the back of the eye. And in most cases, you may need more than one. Typically, you may need multiple injections to help to get the retina back to a quiet state. As I mentioned before, here's an image of a patient that has significant diabetes in the eye. In fact, blood is in the vitreous. So this patient woke up and the patient has sudden loss of vision. And you can be 20/20 before you're even diagnosed or even have changes. So remember, vision is not part of that, but in some cases, it can lead to a dramatic loss of vision. And just really important that in some cases, patients, as I mentioned earlier, there's 8 million people walking around with diabetes that don't know it. And it's through an eye exam in most cases that we detect that they have underlying diabetes. These are just, again, some images of diabetic retinopathy. Here's a patient that has very small bleeds in the back of the eye. This is where we really want these patients to understand. Sometimes with lifestyle changes, you can improve the bleeding. We can intervene with more medication. We usually always send a report to your treating endocrinologist or primary care physician, making sure that your diabetes is well controlled. If the diabetes is not well controlled, if you're not following up, you can progress. And these are new blood vessels. You can see these sort of lacy vessels here. Those new blood vessels that I was mentioning that can develop in patients that have diabetic retinopathy. And of course, the patient's macula can have swelling, and that term is diabetic macular edema. Did you know, based on the latest study that was published, that 1 in 4 people have diabetes in the eye or diabetes eye damage? That's a lot of people. And it's important. It's a call to action to underscore the importance of a yearly comprehensive diabetes eye exam so that we can detect this earlier, intervene earlier, treat earlier, and thus we can prevent loss of vision. So again, some of the symptomologies could be fluctuating blood sugar. So it's important, not symptomology, but some of the risks, excuse me, could be fluctuating blood sugar, elevated blood sugar. When my patients come in, I always ask them their A1C levels. Your hemoglobin A1C or your 3-month blood test, you should really know your numbers. 7 or less has traditionally been what we were striving for in our patients, but the American Diabetes Association recommends close to normal, 6%. So if we can get our patients a little bit better controlled with their A1C would be better. Some patients have a continuous glucose monitor, and it's important for them to know their time in range. So if you have a CGM or you know someone that has a continuous glucose monitor, in addition to their hemoglobin A1C evaluation, they can know every day what their time in range parameters should be. And if they have a good time in range, 70% or higher, well controlled blood sugar level, then it reduces the risk of them developing diabetic retinopathy and some of the other complications and long-term complications. Having diabetes for over 10 years. Duration is the single most important risk. For my patients that come in, if they've had diabetes for a long time, over 10 years, I am definitely dilating their eyes, making sure they don't have retinopathy. Of course, concomitant diseases such as blood pressure and cholesterol can exacerbate or make worse a patient's diabetic retinopathy and risk for other eye complications as well as long-term complications. So we say the ABCs of diabetes. It's important to have your A1C, your blood pressure, as well as your cholesterol well controlled. If you have diabetes during your pregnancy, it's important to definitely get checked early in your pregnancy, typically in your second trimester, just to make sure that there's no retinopathy. And also, if you have pregnancy associated diabetes or gestational diabetes, it's important to get checked every year after just to make sure you don't develop type 2 diabetes. As I mentioned, up to 60% of patients that have gestational diabetes can develop type 2 diabetes within 5 years. And then the single most important risk for all diseases, the single most important risk to reduce long-term complications from diabetes is smoking. Smoking can exacerbate and make worse everything. And so I always tell my patients if they have diabetes, they should not be smoking. So that's something that we want to educate our patients on. So what should you know about diabetic eye disease? Really important that people with diabetes may face several eye problems, as I mentioned earlier, from the front to the back of your eye. You know that they are at risk for dry eyes, they're at risk for double vision, they're at risk for cataracts. Up to 60% of patients with diabetes will develop cataracts. Glaucoma, another potential blinding disease, up to 40%. And then, of course, diabetic retinopathy, the leading cause of vision loss and blindness in patients with diabetes. In working age adults is diabetic retinopathy, but also remember diabetes can affect your macula, so diabetic macular edema as well. Anyone with diabetes is at risk. Anyone, whether it's type 1, type 2, gestational diabetes. Up to 45% of people diagnosed with diabetes will have some degree of retinopathy. 1 in 4 individuals, based on current data, have some eye damage, diabetic retinopathy, diabetic macular edema, glaucoma, cataracts from diabetes. So it's important. In fact, 10 million people have diabetic retinopathy in the United States, and the number just keeps going up. So it's important to take your medication, follow with your doctors and your endocrinologist, reach and maintain a healthy weight, control your ABCs of diabetes, and of course, as I mentioned earlier, smoking cessation is really important. And then last but not least, make sure that you have a comprehensive dilated eye exam every year if you have diabetes. I wanted to provide some times for Q&A. I think Q&A is important. This is a non-formal, more of an educational session. So don't be afraid to put any question in the chat box or just, ask any questions. I'm here to answer as much as I can. But I do want to provide some resources that are available. I know the team at NCBA will also provide some resources for you as well. But you can learn more about diabetes, especially during National Diabetes Awareness Month, here on the NEI, National Eye Institute, Eye Health Education Program. You can learn about eye condition and diabetes. You can see virtually how patients with diabetes and it can impact their vision. Outreach material if you want to help your individuals in your churches and your communities. We do have resources, graphic information for those that are challenged in getting an eye exam. There are some get free or low cost information for patients, as well as, again, the NEHAP National Eye and Health Education Program has some resources and education and awareness about diabetes. All right, so just wanted to provide an overview on diabetes and its long-term effects on the eyes. And so I really want to spend more time answering your questions. So,
Dr. Reynolds, thank you very much. This is Angie, and we have a little bit of reverb here, so I'm going to move back from my computer. But thank you very much for always sharing your very thoughtful presentations with us. And we do have some wonderful questions in the chat, but I am dying to ask this one question. My dad lives with both glaucoma and cataracts. And so the question that I am dying to ask is, why are eye drop bottles so small? And then part two to that is, why are some drugs such as Rocklatan so expensive?
Okay. I can't answer why some drop medications are small, but I can tell you certain medications do come in various sizes or bottles. And so you have maybe 5 mLs, 10 mLs, 15 mLs. So medications that a patient's going to be on, a doctor might write for the 15 ml, knowing that that patient is on it long term. I always tell patients the bottles are small sometimes to bring you back in, so
Oh,
that
I like that.
yeah, that we follow you a little bit closely because this is a progressive disease. We don't diagnose one time and then you're done with us and we treat you. We diagnose you and it's important for you to come back in. So I equate it to your 3-month supply of high blood pressure medication. Usually the doctor will give you a year supply so that you have more oversight, more follow-up, more evaluations, more checking for progression, more checking for adherence to the medication.
Okay. Well, I'm
So
going to run with that one. I like that one.
number
Okay.
2 is that unfortunately the developmental stages of newer medication is costly for some of the pharmacias. So you may have a medication that is a brand. Branded medication are a little bit more expensive than generic. In some cases, you have generic, latanoprost is a medication that some patients may use, and that's a generic of some of the other medication. And generic is a little bit more cost effective. We don't want to use the C word, more cost effective for patients. Sometimes they may not be as efficacious as the brand, but generally they work very, very well. So when you have these neuro medications that are on the market, such as a Rocklatan, or I think you mentioned that one.
Yes.
Unfortunately, again, it is a developmental process through the medication, so that's why the cost is what it is. And they do have, the company has instituted, if you go on their website, there's some patient assistance and some sort of ways to help our patients get the medication. So, Pharmacia understands, and there are ways to assist our patients in getting it a little bit more cost friendly.
Okay.
So, always talk to your eye doctor, talk to your treating physician if there's anything that can help me, you, the patient, maybe ascertain or get your medication in a more cost-friendlier way, cost-effective way. So, not always can they help you. I always say to check and see. Good RX is something that I sometimes look at if patients don't have insurance. Maybe Good RX might help the patients get the medication a little bit more cost effectively. So, just know with even with your systemic medication for diabetes, metformin might be a little bit not as costly as something else. So again, it's the newer medications sometimes and the branded ones. So if there's a little bit of a cost prohibitive nature to taking the meds, you can always talk to your doctor about, the treatment. These medications, the newer ones, work very well. The purpose of newer medication is research and development to increase efficacy in these medications to make sure that we're lowering the pressure. And so these medications work really well. So if you're a treating physician, put your father on Rocklatan, that's the best medication for his condition to slow and prevent loss of vision from his glaucoma.
Thank you. Thank you very much, Dr. Reynolds. Okay, and I'm going to turn to the chat here, and we have a great question here, and it asks, can you please explain the relation between dry eye and diabetes?
Yes. So patients with diabetes tend to have disproportionately drier eyes. So when we think about dry eyes, now there's so much out there about dry eyes, so many new medications for dry eye. You probably saw the commercial for MyBo and other medications. So there's all these newer ones that are on the market for our patients that you can talk to your doctor about. A lot of time, direct to marketing, consumer marketing, patients come in sometimes saying, I want this drug because I saw the commercial. But back to your question, why does diabetes lead to drier eyes? Diabetes is a vascular disease. It's a blood vessel disease. And as I mentioned earlier, when the blood vessel is compromised, when the vasculature is compromised, you don't get the necessary flow to the eye like you should. And so if there's a disturbance in the flow to the eye, the patient can get drier eyes than normal. So, and then the other thing is if your A1C is elevated, that impacts the vascular stability of the vessels, right? Not just in the eyes and around the eyes, but also large blood vessels. So, it's when we think about dry eye, it's a microvascular disease as well. It's not just inflammation. You get inflammation of the glands around the eyes. You get inflammatory cytokines or inflammatory cells that release. But diabetes is also an inflammatory disease. So it's a vascular disease that have inflammatory components.
Okay. Dr. Reynolds, if my optometrist doesn't ask about my A1C levels, what should I do?
So you should tell them because
Okay.
all optometry should. So if you're going to see an eye doctor for a comprehensive eye exam, and sometimes you see their technician, sometimes you see their an office person, and then you see the doctor. So make sure that if they're asking your medical histories, I have type 2 diabetes. How long? I would say I have type 2 diabetes. I have it for about 10 years because sometimes they don't ask duration. Remember, duration is important. And then also, too, you're going to say to them, it's well controlled. My A1C is because all doctors, I mean, my students are taught to ask the patients their A1C. So it's important to know that because, if you're giving the patients glasses and their A1C is elevated, you want to know that because those glasses, the prescription might change. So sometimes it's not always the doctor's the tech, but if your doctor doesn't ask, I say offer that information. And I wanted to go back on diabetes again. It's a inflammatory disease that has vascular components. So diabetes is an inflammatory disease. I think I said it there, reversal.
Okay, and so Dr. Reynolds, I want to build a little bit upon that. Again, it's something you said that strikes a chord with me. You've spoken to comprehensive eye examinations, and we know we need to tell our doctors that if we have diabetes, that we have diabetes. But what is in fact a comprehensive eye exam, and how do we know as a patient, maybe new to this doctor, that we are having a comprehensive eye exam? Again, I'll pick on my dad a little bit because I'm the primary caregiver and I take him to the optometrist. And I know our last visit was a couple of hours visiting, and I assume it is comprehensive or it was comprehensive. But how do I know? I
Thank
do
you for
know they
that.
never asked me if my dad has diabetes. And so that raised a bell with me. So again, how do we know in this world of fast pace everything?
I'm so glad you asked. Thank you for that question. A comprehensive eye exam includes dilation. So, comprehensive dilated eye exam. So, when you go to an eye doctor, not only are they doing your histories and checking for your glasses and or contact lenses, they're checking the health of your eyes. I always tell my patients you can have good vision but poor health of your eyes. Remember, a patient with diabetes impacting the back of the eyes can have 20/20 vision and say they have good vision but have retinopathy, which is eye health. So, a comprehensive exam includes assessing the health, whether it's the front of the eyes, as well as checking your pressure in your eyes, and then also dilating your eyes. Now, we do have newer instrumentation, retinal imaging devices. Some doctors take pictures of the eyes and assess. And I do too. My patients in my diabetes service, it augments my care. And some doctors love that, and I have no problems with that. But the American Diabetes Association also recommended dilated exam. So you clinically, or that doctor clinically looks in the eyes. So as long as you're assessing the retina, and they're doing a thorough health evaluation of your eyes. That's a comprehensive eye exam. It's not just, there's some places that just check you for glasses. You may go to a doctor and all they do is just check you for glasses. They don't do anything else. That's not a comprehensive exam. A comprehensive exam will do a thorough assessment of not only your visual health, but also your eye health, your vision, but also your visual health and your eye health. Mhm.
Okay, and we get a comprehensive exam from an ophthalmologist versus the optometrist, or
I'm glad you asked that question. You will have so basically a comprehensive exam can be done by both. Usually I see you as an optometrist, I'm doing a comprehensive assessment of the eye or evaluation and exam. If you have bleeding in the eye and I refer you to a retinal specialist, their focus now is on the retina. So they're going to dilate those patients' eyes, treat those patients' eyes, and see those patients more for management and treatment. For me, I might see the patient back as a follow-up to make sure that they're being followed by the retinal specialist. And why that's important, and I underscore the important role of optometrists, is that there are a lot of patients that come in. Again, 8 million people don't know they have diabetes. And one of the clinical signs could be changes in the back of the eyes, include bleeding in the back of the eyes. And so we would see those patients more frequently, every 3, 4 months, 6 month follow up. When the patient needs injection or treatment, that's when we usually co manage with a retinal specialist. And of course, a retinal specialist has to see your retina. So they're going
yes.
to dilate and treat. If you have cataracts and the cataracts are not interfering with your vision and you don't have a significant retinopathy, the optometrist can follow you. I follow those patients. But when you're needing cataract surgery, and that's when your vision is declined, your quality of life is impacted from the cataract, you can't drive, you can't sew, you can't do the things that you used to do, and your vision is reduced when we check your visual acuities, then we refer you to a cataract surgeon. And again, that cataract surgeon is going to do some tests. They're going to dilate the eyes, and they're going to recommend you for cataract surgery. They're going to assess you after the surgery to make sure that there's a successful outcome, and they're going to follow you as well. Now, if you have diabetes and you have glaucoma, and you have eye pressure, most optometrists will follow you. I can follow you. But if patients have advanced disease or the patient has severe condition, we will always co-manage with a glaucoma specialist or an ophthalmologist to treat those patients. If the patients need specific surgeries, an ophthalmologist might be co-managed with for the patient to get their maximal, most effective best care for the patient. So yes, an optometrist is going to do a comprehensive, but so is a ophthalmologist. But when they see a specialist, it's more focused, driven examination.
Okay, thank you. Thank you very much, Dr. Reynolds. We have a question and a comment and a question in the chat, and it reads, surprised to learn about diabetes after my mom developed it. Can you develop after loss of thyroid?
Can you develop diabetes after loss of fibroids? Again, it really depends on the patient in the chair. I would need to know the whole history. Was their weight? We know one of the biggest risk factors for developing diabetes is weight, right? So we know patients that have diabetes, a disproportionate number of them had weight issue. We talked about the medication for weight loss. One of the indication that some patients might get to treat them is pre-diabetes to prevent them from becoming diabetes. So I'm not sure if this patient's fibroid led to weight. I would definitely talk to the patient's doctor. Genetics, if there's a family history of diabetes, you can develop type 2 diabetes at any time. Even with concomitant other conditions. So maybe that she had this condition, but she was also at risk of developing type 2 diabetes. Remember, we talked about diabetes could be secondary to medication use and other conditions. So it's really important to talk to the patient's treating physician and or talk to your treating physician. Again, it's who's in the chair. So wouldn't be able to say that that caused the patient's diabetes, but I would definitely ask that person to speak to their physician more about it, especially if they have the genetic risk factor for developing.
Okay, okay, thank you very much. We have a question here that asks, does the GLP-1 inhibitor or other weight loss drugs affect eye health?
Well, you have been seeing some literature lately and some call to action about eye health and these medications. So yes, there have been some research that have pointed to fluctuating vision or changes in the patient's vision. The retinopathy can be impacted, and then in some cases it might cause some other changes. So if you're on these medication, I guess it's important to note if you experience any eye problems, blurrier vision just make sure that you're being checked. I tell patients who are on these medications to make sure that they're evaluated, to make sure that there's nothing, complications going on. If you have sudden loss of vision, and you're on these medication, you need to seek care emergently.
Okay, so Dr. Reynolds, fact or myth, do carrots improve eye health?
Carrot is not bad for you.
Okay,
Carrot will improve your overall health, but there's no one study that says yes or no to that question. I just say eat healthy. Studies have shown that eating healthy, foods that are good in and are good in antioxidation. Your spinach, your kales, your fruits. And that's a little hard in patients that have diabetes to eat certain fruits because of the fructose. So I always say talk to your nutritionist. Make sure if you have diabetes, you're maybe seeing a nutritionist for additional care. They're an important part of the diabetes healthcare team. So make sure that if you have questions about which foods, which diet, talk to your nutritionist and they can give you better guidance. But we do know eating healthy can improve eye health.
okay, and then before we jump in the chat, I want to ask you, does Medicare, Medicaid, private insurance, do they pay for for eye health care?
Well, again, most of these insurances have a you have a secondary plan, a secondary payer. Most Medicare is like, AvMed Medicare. But if it's straight Medicare, they don't typically pay for glasses and a refraction, but they do pay for eye health assessment for the patient. So if we need to do additional imaging, retinal imaging, photos, typically those insurance do cover that. So I would say check with your insurance to see. Most insurance cover one yearly comprehensive eye exam, in some cases with glasses. So check with your insurer and see what your plan says. But I will say that the patients that I see here in my clinic, usually the insurance covers it if it's Medicare. Not
Okay,
for just glasses. So I
not
think
for
the
just glasses.
misconception is, can I go in and just get glasses with Medicare? I think that's where there may be some deductible, but don't quote me. But if the patient has cataracts and the patient has diabetic retinopathy and they're remonitored, yes, Medicare should pay for medical eye care. That's considered
Okay.
medical eye care.
Thank you, Dr. Reynolds. Dr. Reynolds, you spoke to the genetic correlation, that there might be a genetic correlation, but
No,
in
no,
terms
no, not might.
not, oh, there is.
It is.
Okay, there
Yeah.
is. Okay. Excuse me. So can I ask you to expound on that a little bit? I
Well,
know for me, we
mhm.
have, my brother and I, after my father diagnosed for glaucoma, were ordered to go have tests because of the genetic, of him being our dad. So can I ask you to speak to the importance of, if you know your parent or your mother, whomever it may be, father, that children family members should go have a comprehensive eye exam?
Again, genetics is so important. Not to go into the science of genetics, but you are who you are because of your parents' DNA, right? So we know diabetes is a genetic disease. If your parents have it, you have a higher risk of having it. Now, the onset of that condition differs. And so some patients may have an onset earlier, onset later, but there is a genetic, you know, component to all diseases, really. So diabetes is no different. So I always say to my patients, if you have it, then your family member may have it. Now, sometimes it may skip a generation, but 9 times out of 10, when I talk to my patients, and they have this condition. Oh, my mom had it, my uncle had it, my grandmother had it, runs in the family. So
Mm-hmm.
it's important if you're diagnosed with glaucoma. Again, diabetes can lead to glaucoma, but glaucoma in of itself is a genetic disease. So you don't have to have diabetes to have glaucoma. So if you have a family member that has glaucoma, you should get checked. If you have a family member that has changes in the eyes, macular degeneration is a genetic disease. So I always tell my patients, you didn't get this disease in a vacuum. 9 times out of 10 is genetics. But as I mentioned earlier, there are other causes, of this condition. Medication might cause this condition. Um, certain other conditions, and we know that patients that had COVID-19, there's a lot of new onset diabetes. So it's not always genetic, but the number one is genetic. So I would say if you have diabetes or your family member has diabetes, get checked for diabetes.
Okay, thank you, Dr. Reynolds. We have a great question here in the chat, and it asks, can you speak to vitamins and how they improve eye health?
So, and to speak to vitamins, there was a big study by on age-related macular degeneration. It showed the value of lutein and zeaxanthine in the eye and other different carotenoids type of vitamins in the eye. And so, um, that study has led to just a lot of more studies that show the benefit of lutein and zeaxanthine in eye health. But there's no one concrete study that has shown that it stops the disease. It helps improve blood flow to the eye. It minimizes oxidative damage and oxidative stress in the tissues in the eye. So I do talk to my patient about nutraceuticals and vitamins for eye health when they do have diabetes. There was a study that showed that certain carotenoids, lutein and zeaxanthine, is beneficial for eye health, and so I do recommend that for patients that have diabetes to slow their disease in some cases, or to improve blood flow to their retinal health. So you know, some people would say there's no one study that really concrete say that. Well, like I said before, we just want to improve eye health. So if we can help these patients by eating healthy exercising, as well as lutein and zeaxanthin and some vitamins. I rather that for my patients in some cases. But just know when you're doing this, talk to your nutritionist as well. I always advocate. They know so much more than I do. I know the back of the eyes. But if you have diabetes, I think you should be, talk to your primary care physician to kind of refer you to a nutritionist. They're, again, an important part of the diabetes healthcare team.
So Dr. Reynolds, and can I just build on this a little bit? How important is it for us, all of us, one way or another, are glued to our devices? And how important if we have diabetes and we have eye health challenges, how important is it to get off of our devices or for those of us who work in front of a computer to have the glare screens, etc.
Again, there were competing studies that looked at these devices and blue light, and it's not even blue light or the devices. It's the amount of time you're on these devices.
Mm.
Put a bet on these devices. So there's a lot of studies looking at these devices and its impact on overall health, not just eye health. And so I would say you're not getting enough sleep. If you're not getting enough sleep, we're in a perpetual state of inflammation, cortisol release, and we don't want to be in a perpetual state. So good sleep is important. So we need to get off our devices. Blinking properly. A lot of times we stare at the screen. We need to look away and give our eyes break after about 20 minutes on the screen. So, because not, it's a lot of times we're not blinking properly. So our eyes get dried out a little bit more. And then, of course, they do have some blue light blockers for glasses if you're on the screen to help minimize the blue light getting into the eyes that can lead to cell changes. So I would say with these devices, monitoring your time, taking breaks from these devices is important. If you have dry eyes and you talk to your eye care practitioner about that, they'll assess your eyes. They could treat your eye condition with either over-the-counter drops or they may prescribe an eye drop for dry eyes. And of course, if you have for your retinal health, I always advocate for my patients to minimize or take frequent breaks from their devices. Make sure they're getting good night's sleep, making sure they're not going to bed with these devices in their faces. So,
Oh, okay, guilty. Thank you for that reminder. And just to build on the retinal health part of our discussion here, how important is ample lighting?
again, studies have shown, and my daughter reads in the dark, and I hate her that she reads in the dark. Ample lighting is very important. Fluorescent lighting, good lighting is important. For eye health. Going out in the sun is important for eye health. So, you know,
With glasses, with
yeah, of course. When
sunglasses.
you go outside in the sun, make sure you have UV protection on to minimize damaging rays. I mean, the same concept about UV protection, UV damage to the eyes can lead to cataracts formation, wrinkling of your skin. So UV protection is very important when it comes to eye health. So most of your glasses have UV protection in there for patients. But when we talk about ample lighting, I want you to be outside a little bit for eye health. We're so much inside, we're so much on our computer. Take frequent breaks from your computer, of course, when your eyeglasses outside or sunglasses for UV protection. Not reading in the dark.
Not reading in the dark. Yeah, I'm guilty of that one also too, not just your daughter. We have a question here, and it asks, what is the correlation between diabetes and nerve problems?
Again, diabetes is an inflammatory disease. It's a vascular disease. It impacts the vessels. Your vessels are important when it comes to bringing nutrients and oxygen to your nerve tissue. And so the most important thing to remember if you have diabetes, diabetes is a disease, it's an inflammatory disease, and it leads to blood vessel challenges and your blood vessels in your body supply everything. And so if your blood vessels aren't working properly because your blood sugar level is too high, it leads to a constellation of inflammation and ischemia or lack of oxygen, it leads to a constellation of other problems, from the eye to the kidney to the feet, to the nerves, to your heart, to your brain, and everywhere in between. And, so that's why it's important to get your blood sugar under control if you have diabetes.
That's a perfect segue to closing out this webinar and saying thank you for always supporting our efforts here, Dr. Reynolds, and for your thoughtful presentations. As a caregiver, I'd like to say to our audience, please have your eyes examined. Please know if you have diabetes. In addition to changing your quality of life, it also changes your caregiver's quality of life. And so it's really important that we all try our level best to have optimal eye health. Well, again, Dr. Reynolds, thank you very much.
Thank you so much for having me. Have a beautiful day. And again, congratulations on the new building. And
thank you. We look forward to hosting you, and to our audience, thank you very much for joining you. And we look forward to seeing you at our next webinar. Have a good afternoon, everyone.
thank you.
Bye-bye.